So part 3 of chapter 7 reviews medications and drug therapies. So an antiarrhythmic agent suppresses fast or irregular heart rhythms. An anticoagulant prolongs clotting time. A hemostatic agent stops the flow of blood within vessels. Hypolipidemic agents lower cholesterol levels, and nitroglycerin is a vasodilator used for angina pectoris. Thrombolytic therapy is the administration of an intravenous drug to dissolve a blood clot. A vasoconstrictor decreases the size of blood vessels. A vasodilator increases the size of blood vessels. When we talk about specialties or specialists associated with cardiovascular or lymphatic, we talk about a cardiology is a medical specialty concerned with the diagnosis and treatment of heart disease. A cardiologist is the physician who specializes in cardiology. Cardiac electrophysiologist is the medical specialty concerned with the electrical activities of the heart. Sometimes they're just referred to as an electrophysiologist, but really technically it's a cardiac electrophysiologist. And that's the physician who specializes in cardiac electrophysiology. Lymphedema therapy is the medical specialty concerned with the treatment of lymphedema. Lymphedema therapist is one who specializes in lymphedema therapy. Abbreviations for this chapter that you're going to see quite often is ASC, acute coronary syndrome. ASHD is arteriosclerotic heart disease. BP, blood pressure. CABG, CABG is a coronary artery bypass graft. And you can see something I'm going to point out about abbreviations, which I noticed that people are doing, is it's important that you spell them correctly. Points will be taken off if they're not spelled correctly. Use capitals when you need capitals. Do not use capitals when you don't need. If you're starting the beginning of a sentence, you may need to use a capital, but if something's in the middle, unless the abbreviations are specifically uppercase or lowercase. CAD, so you can see all these ones on this page are uppercase letters. So CAD is coronary artery disease. CHF is congestive heart failure. DVT is deep vein thrombosis. ECG or EKG is used interchangeably for electrocardiography. HTN for hypertension, and MI for myocardial infarction, and MRI for magnetic resonance imaging. A PTCA is the percutaneous transluminal coronary angioplasty. A PVC is the premature ventricular contraction. RHD is rheumatic heart disease. And that's it. So that's the end of this chapter. Lots to do and learn. Be sure to review all the lectures, do the practice and prep you, make sure you're doing your quizzes, and make sure you're really reviewing for that midterm exam coming up soon.